Frontline health workers are the unsung heroes of this pandemic. Every day, they risk their own lives to save the lives of others. Bhekisisa Centre for Health Journalism spoke to 29 doctors and nurses from around the country about their fear, access to protective gear, and whether they are being tested for COVID-19. Let's take a look.
My husband and I are both doctors. My biggest fear is that we will be infecting our children, or worse, die of COVID and leave my school-going kids without parents.
I am an anaesthetist. Having to take a COVID-positive patient to theatre is stressful and scary. I fear that treating such patients could infect me, but I know it is my duty to continue. The most stressful part is intubation and extubation.
I fear that we may not have a vaccine on time and that this will be an ongoing problem for years to come.
I fear that if I get infected, I will definitely die, as I have an underlying illness.
I'm 74 and still working out of necessity. I have underlying health problems as well as hypertension, and this puts me well into the group of vulnerable people. I haven't worked during lockdown, but feel that if I don't return, I will in all probability never work again.
I'm a medical officer in general surgery. Even before the outbreak of COVID-19, we had a shortage of PPE. On multiple occasions prior to a surgery, there would be no visors to operate with to prevent an eye splash. Now, with the current global lack of PPE, I'm most afraid that I will need to operate on a COVID-positive patient and not have proper PPE. And guess what? We will continue to operate and put ourselves at risk, as we do now.
I work in a big and busy practice. I've had to supply my own masks, hand sanitizer, and remind the cleaning staff to wipe down surfaces. There is one toilet for 8 doctors, and this is also used by patients and the admin staff. It should be cleaned frequently during the day, but this doesn't happen. This is in the northern suburbs of Johannesburg. Heaven only knows what is happening in poor areas.
The virus is faster than the bureaucracy. We're constantly behind in planning. COVID-19 has exposed weaknesses in leadership like never before, as well as serious lack of clarity around priorities.